Good morning, Alex and friends. I'm Grace. Today is Thursday, July 10th, 2025, and you're listening to Alex's News. The weather in Riverside today will be hot, reaching a high of 99.4 degrees Fahrenheit with a low of 72.2 degrees, so be sure to stay hydrated and find shade if you're spending time outdoors. Coming up on Alex News, we'll dive into the critical question of why we're seeing a significant surge in measles cases across the United States. We'll also examine the complexities surrounding record funding allocated for immigration enforcement and why it's currently encountering substantial hurdles. All these important stories and more are coming up next, so don't go anywhere. Stay tuned. Welcome back. We're starting this morning with some sobering news on the public health front. The United States is grappling with a significant measles resurgence, marking a concerning milestone a quarter century after the disease was officially declared eliminated here. For more on this unfolding story, we turn to our health reporter, Ethan. Ethan, give us the latest numbers.
Grace, it's certainly a disheartening situation. According to reporting from NPR, ABC News, and CBS News, the United States has now reported 1,288 measles cases as of yesterday, July 9th, 2025. This is a truly alarming figure, as it marks the highest level in 33 years, surpassing the total seen in 2019, and puts us well on our way to the 2,126 cases we saw back in 1992.
That's a huge jump. Where are we seeing these cases pop up? Is it widespread, or are there particular hotspots?
It's a mix, Grace. The confirmed cases span across 38 to 39 states and the District of Columbia. However, a significant portion of this surge is attributed to one major outbreak in Texas, accounting for 753 cases. As CBS News reports, this Texas outbreak is predominantly in West Texas and originated in a rural Mennonite community with a notably low vaccination rate, primarily affecting unvaccinated children and teenagers. The Centers for Disease Control, via Yale and Johns Hopkins University, has genetically and epidemiologically linked this Texas outbreak to a measles surge in Chihuahua, Mexico, indicating cross-border transmission. Overall, ABC News tells us the CDC has identified at least 27 distinct outbreaks this year, up from 16 in 2024, with 88% of confirmed cases being outbreak-associated. It seems we're seeing a real rash of cases across the country.
It sounds like measles is making a comeback with a vengeance. Ethan, it isn't just about a rash, is it? What are the human consequences of this rise in cases?
Unfortunately, Grace, the human toll is significant. Nationwide, we've seen 155 hospitalizations, with approximately 13% of this year's cases requiring hospitalization, primarily among children under the age of 5, according to NPR and ABC News. Tragically, there have been 3 confirmed measles-related deaths. NPR, ABC News, and CBS News have confirmed that these include 2 unvaccinated school-aged children in Texas and 1 unvaccinated adult in New Mexico. Experts like Caitlin Rivers from Johns Hopkins University and Dr. Adam Ratner emphasize that measles is one of the most infectious and preventable diseases known. Before widespread vaccination, it caused 400 to 500 annual child deaths in the U.S. and remains a leading cause of blindness globally. It's an airborne disease, viable for up to 2 hours, and individuals are contagious for days before even developing a rash. Severe cases can lead to life-threatening complications such as pneumonia, encephalitis, or cognitive issues. There's no specific antiviral cure, only symptomatic care, which makes prevention paramount.
So, if it's so preventable, what's driving this concerning resurgence? Are vaccination rates dipping?
Precisely, Grace. The primary driver is indeed declining kindergarten vaccination rates, which are currently at 92.7% nationwide. This falls short of the 95% threshold needed for robust herd immunity, as reported by NPR and ABC News. This decline is broadly attributed to increased vaccine hesitancy. CBS News points out that the national MMR vaccination rate decreased from 93.92% in 2017 to 2018 to 91.26% in 2023 to 2024, a trend that predates but was exacerbated by the COVID-19 pandemic. AP News reports that the number of children with non-medical exemptions also reached an all-time high in 2023 to 2024. ABC News reveals that a vast majority, 92%, of confirmed cases in 2025 are among individuals who are unvaccinated or whose vaccination status is unknown. This leaves approximately 280,000 or 7.3% of U.S. kindergartners not fully vaccinated. Dr. Peter Hotez warns this is, quote, just the beginning, unquote, as low county-level rates are eroding herd immunity, despite seemingly adequate national figures.
That sounds like we're in danger of losing our measles elimination status. Can you explain what that means and the implications?
You hit the nail on the head, Grace. Experts are indeed warning the U.S. is in, quote, great danger, unquote, of losing its measles elimination status, according to NPR and ABC News. The World Health Organization defines elimination as the absence of endemic measles virus transmission for at least 12 months, with strong surveillance. Losing this status would be a monumental public health setback, transforming measles from a controlled imported threat to an actively circulating disease within the U.S. As Direct Relief and Johns Hopkins University have reported, the practical implications are dire a blow to our global vaccination leadership, increased widespread transmission risk, immense strain on public health resources for investigation and tracing, and critically, increased morbidity and mortality, especially for the unvaccinated or immunocompromised.
Speaking of importations, how much of a role is international travel playing in seeding these outbreaks?
International importations do play a role, but they are not the primary driver of the sheer number of cases we're seeing now. The CDC, via Yale, states that as of April 17, 2025, 6% or 48 cases were directly imported from other countries, with 92% of those being U.S. residents who had traveled abroad. As I mentioned, the large Texas outbreak has been genetically linked to a measles surge in Chihuahua, Mexico, identified as genotype D8, a wild-type strain circulating internationally. Additionally, the CDC has identified 5 distinct genotype B3 sequences in cases from various U.S. states, aiding them in establishing foreign country sources.
So what exactly is being done at both the federal and state levels to combat this, especially with vaccine hesitancy being such a major factor?
A lot is being considered and implemented, Grace. On the federal side, HHS has its Vaccines National Strategic Plan for 2021 to 2025, aiming to strengthen infrastructure and address hesitancy. Politico reports that HHS Secretary Robert F. Kennedy Jr. has reconstituted the Advisory Committee on Immunization Practices, or ACIP. The CDC is also providing ongoing technical assistance, and there's a push for increased public health funding for the CDC's Section 317 immunization program. CMS has also introduced a new requirement for Medicaid and CHIP to cover approved ACIP-recommended vaccines without cost sharing. State-level responses, as the Minnesota Medical Association highlights, urge addressing non-medical exemptions. New Mexico has launched a dedicated online vaccination resource, and Washington, D.C. successfully increased its kindergarten MMR rate to 92.7% in 2024 to 2025 by improving vaccine accessibility and public education, according to the Big Cities Health Coalition. Broader recommendations include expanding qualified vaccinators and improving reimbursement.
Ethan, you mentioned HHS Secretary Robert F. Kennedy Jr. There's a significant lawsuit related to him, isn't there?
That's right, Grace. This past Monday, July 7, 2025, just 3 days ago, major medical associations, including the American Academy of Pediatrics, the American College of Physicians, and the American Public Health Association filed a lawsuit against U.S. Health Secretary Robert F. Kennedy Jr. in Massachusetts. IDSA and AJMC.com report the suit alleges Kennedy acted, quote, arbitrarily and capriciously, unquote, by unilaterally altering COVID-19 vaccine recommendations for children and pregnant people, and by dismissing 17 ACIP members to appoint replacements with anti-vaccine views, thereby undermining scientific recommendations. The plaintiffs are seeking injunctions against his changes and a declaration of their unlawfulness. No court dates have been announced yet.
That lawsuit certainly adds another layer to this complex issue. Ethan, looking ahead, what's the CDC's overall risk assessment for the U.S. population?
The CDC maintains that while the overall risk of measles infection is low for the U.S. population compared to other countries, it is significantly higher in communities with low vaccination rates and those with connections to active outbreaks. These ongoing outbreaks, Grace, underscore the critical need for sustained strategic investment in public health infrastructure, community trust building, and evidence-based communication to address vaccine hesitancy and ensure high vaccination coverage nationwide. It's a challenging situation that requires everyone to roll up their sleeves and play their part.
Ethan, thank you for breaking down this very important and concerning story for us. We appreciate your insights. That was Ethan with story 1 of 2 this morning. Welcome back. We turn now to a major piece of legislation that was signed into law just 6 days ago, on July 4th, marking a significant shift in U.S. immigration policy. President Donald Trump signed the One Big Beautiful Bill Act, or OBBBA, into law following its passage in the Senate. This comprehensive budget reconciliation law is a cornerstone of President Trump's second-term agenda. For more on what this means for the country, we turn to our reporter Chloe, who has been sifting through the details. Chloe, can you walk us through the highlights of this bill?
Grace, this bill, H.R. 1, is indeed a game-changer for federal immigration enforcement. According to reporting from CBS News, it earmarks approximately $170 billion for immigration and border enforcement-related provisions through September 2029. This represents the largest infusion of funds Congress has ever dedicated to federal immigration enforcement. It really is an unprecedented boost for agencies like U.S. Immigration and Customs Enforcement, or ICE, and Customs and Border Protection, CBP.
That sounds like a monumental sum. How will this massive injection of funds specifically impact ICE, an agency that often finds itself in the headlines?
It truly supercharges ICE, Grace. CBS News reports that this new legislation includes an extraordinary additional $75 billion specifically for ICE, making it the highest-funded federal law enforcement agency in the United States. To put that in perspective, as detailed by various sources including FBI.gov, DEA.gov, and DHS.gov, the Federal Bureau of Investigation's annual budget for fiscal year 2025 is $11.3 billion, while CBP's is $19.76 billion. Some reports, including those cited by Wikipedia, even indicate that ICE's funding could increase from around $10 billion to over $100 billion by 2029. As Kathleen Bush-Joseph of the Migration Policy Institute put it, this bill will, quote, supercharge immigration enforcement, end quote.
Wow, that's a dramatic increase. So where will all this money be going within the immigration enforcement apparatus? What are the key areas receiving these significant allocations?
The funds are allocated across several critical areas, Grace. According to CBS News and the American Immigration Council, $45 billion is allocated for ICE's detention system over 4 years. This aims to significantly expand capacity, potentially doubling it to over 100,000 detainees at any given time, up from the current average of around 58,000. That's a 265% annual budget increase to ICE's current detention budget. Then, nearly $30 billion is directed towards ICE's enforcement and deportation operations. This substantial funding will enable ICE to hire up to 10,000 additional deportation officers, drastically increasing their current force of fewer than 6,000. It will also boost transportation assets like deportation planes and allow for more agency prosecutors. The goal, experts suggest, is to help the administration pursue deporting close to 1 million people annually, as reported by CBS News.
And what about securing the border itself? Is there a significant focus on physical barriers and patrols?
Absolutely. Over $46 billion is allocated for Customs and Border Protection, CBP, to build, install, and improve physical barriers, access roads, and surveillance technologies along the U.S.-Mexico border. According to CBS News, this amount is more than 3 times what the Trump administration spent on the wall in its first term. Additionally, CBP will receive an extra $12 billion for Border Patrol agent vehicles, facilities, training, hiring, and bonuses. There's also a new $10 billion catch-all pool established for the Department of Homeland Security, DHS, to safeguard U.S. borders. The bill also includes $13.5 billion to reimburse states for their immigration enforcement actions, potentially funding initiatives like Texas's Operation Lone Star, as CBS News has reported. Though some reports from the Immigration Forum and American Immigration Council specify this reimbursement amount as $3.5 billion.
It sounds like an ironclad plan for enforcement, but what are critics saying about the potential downsides or unintended consequences of such a broad, enforcement-heavy approach?
Critics are sounding the alarm, Grace. Andrea Flores, a former Biden administration immigration official now with FWD-US, stated to CBS News that she anticipates, quote, inhumane and, quote, detention conditions and, quote, more deportations than we have ever seen in modern history, end quote. Concerns have been raised about increased interior enforcement, with fears that ICE raids could become an everyday occurrence, potentially leading to more racial profiling. Economically, independent organizations project significant negative impacts. For instance, the Peterson Institute for International Economics, PIIE.com, estimates that mass deportations could lead to U.S. GDP being between 1.2% and 7.4% below the baseline by the end of 2028. The American Immigration Council, in an October 2024 analysis, found that mass deportations could reduce U.S. GDP by 4.2% to 6.8%, due to the loss of workers and increased inflation. There are also concerns about significant reductions in tax revenues as undocumented immigrant households paid $46.8 billion in federal taxes and $29.3 billion in state and local taxes in 2022, according to CBO.gov and KFF.
Given these vast sums and stated goals, how realistic is it that this bill will actually achieve a massive increase in deportations, or are there practical limitations at play?
That's the million-dollar question, Grace. Despite the massive funding, independent expert analyses and historical data suggest that a dramatic increase in funding and personnel doesn't necessarily translate into a proportionally dramatic increase in deportations. For example, the National Foundation for American Policy, NFAP.com, has indicated an, quote, overall lack of a correlation between illegal entry and immigration enforcement spending, end quote. The practical scale of deportations is often limited by several critical factors. One major bottleneck is the immigration court system. According to the American Immigration Council, from fiscal year 2003 through 2024, Congress spent $24 on ICE and Border Patrol for every $1 spent on the immigration court system. This imbalance has led to a backlog of over 3 million cases, with over 3.7 million cases pending as of mid-fiscal year 2024, a 2,000% increase since 2007. Experts referenced by the American Immigration Lawyers Association and the American Immigration Council anticipate that a surge in arrests and detention without a commensurate increase in immigration judges will lead to even greater backlogs, hindering removals.
That's quite the legal logjam. Finally, Chloe, this bill passed through budget reconciliation. For our viewers at home, can you explain what that process entails and why it was used here?
Of course, Grace. The One Big Beautiful Bill Act was indeed passed through budget reconciliation rules in the U.S. Senate. This process, as explained by House.gov and the Center on Budget and Policy Priorities, allows for the passage of certain federal budget legislation with a simple majority vote, bypassing the usual 60-vote filibuster threshold. While primarily for changing spending or revenues, it can include measures with a direct budgetary impact. The Senate parliamentarian determines whether a provision violates the Byrd Rule, which ensures the provisions have a direct budgetary effect. In this case, the provisions of H.R. 1, which directly allocate funds for enforcement and facilities, were deemed permissible. It allowed President Trump to achieve a legislative victory with a simple majority.
Chloe, thank you for breaking down this significant new law for us. It's clear there's much to watch in the coming months and years as these policies are implemented.
You're welcome, Grace.
Here are some other headlines. On Wednesday, July 9, 2025, former President Donald Trump announced a tariff-icy new trade policy, a steep 50% tariff on all Brazilian imports, effective August 1st. He explicitly linked this to the, quote, hunt prosecution of former Brazilian President Jair Bolsonaro, also citing Brazil's insidious attacks on free elections and the fundamental free speech rights of Americans. Brazil's President Lula da Silva swiftly declared his nation's sovereignty, stating such tariffs would trigger Brazil's economic reciprocity law. The U.S. actually runs a trade surplus with Brazil. This unique Brazilian action is part of broader tariff letters sent to over 20 countries. In international news, the Trump administration on Wednesday sanctioned Francesca Albanese, the UN Special Rapporteur for the West Bank and Gaza, in the latest U.S. effort to punish critics of Israel's Gaza war. Secretary of State Marco Rubio accused her of quote, political and economic warfare and anti-Semitism. Ms. Albanese, a vocal critic, has called Israel's actions genocide, a claim denied by the U.S. and Israel, and has urged nations to pressure Israel. Albanese dismissed the sanctions as mafia-style intimidation techniques. The action came as Israeli Prime Minister Benjamin Netanyahu visited Washington. Closer to home, there's been a high-profile exit in the tech world. Linda Yaccarino resigned as CEO of X, formerly Twitter, on Wednesday, July 9, 2025, ending a 2-year, turbulent tenure. Appointed to stabilize ad revenue after Elon Musk's acquisition, Yaccarino faced ongoing brand safety issues, advertiser boycotts, and heavy debt. While her resignation came a day after X's AI chatbot, Grok, posted anti-Semitic content, sources say the departure was planned earlier, likely due to a lack of fit with Musk's continued hands-on control. No successor has been named, adding to the turbulence within Musk's broader business empire. Meanwhile, a new analysis is raising a flood of concerns regarding public safety. A joint investigation reveals FEMA significantly underestimated flood risks at Camp Mystic in Texas, where over 24 people died. New maps show more cabins, including 4 young camper cabins in FEMA's own extreme flood hazard zone, and 8 buildings in the floodway were vulnerable. Experts warn no one should be in a floodway. This highlights a national issue. FEMA's maps often fail to account for rainfall and flash flooding, leaving millions unaware of true risks. FEMA reportedly lacks the mandate and funding to update these maps. The July 4th flood at Camp Mystic saw the Guadalupe River rise 26 feet in 45 minutes. Finally, there's a shot at the top for a new health leader. The Senate Help Committee voted 12-11 along party lines on Wednesday, July 9, 2025, to advance Susan Menarez's nomination to be President Donald Trump's director of the CDC. Manarez, acting director since January, would be the first CDC director requiring Senate confirmation. With 2 decades of federal health experience and a PhD, she'd be the first CDC director without a medical degree since 1953. During her hearing, Manarez supported vaccines, stating they save lives and denying any link to autism, contrasting with HHS Secretary Robert F. Kennedy Jr.'s views. If confirmed, she will wield significant power over vaccine policy amidst ongoing CDC instability. That's all we have for now. Today's episode was made by Alexander King with Claude Sonnet 4.0, Gemini Pro 2.5, Gemini Flash 2.5, and Google Cloud Text-to-Speech. I hope you have a great day. I'll see you tomorrow, Alex.